Hello again, Dr. Derek Rogalski with Bay Bariatrics. We have a video series where we're answering common patient questions. One of the common questions we get is, what is dumping syndrome and how do I avoid it? So dumping syndrome comes in a couple different varieties, but the basic problem with dumping syndrome is that sugar or carbohydrates are hitting the distal part of your intestine, a further down part of your small intestine, quicker than they're supposed to. So our body has this really nice regulated system where there's a valve called the pylorus at the bottom of our stomach, and it gives us a little bit of our meal at a time, allows our pancreas and our liver to give the nutrients in the factors into our intestines to help us absorb those carbohydrates and other nutrients. Dumping syndrome happens when too much of that carbohydrate or nutrient hits the small intestine too quickly, and it can cause derangements in both insulin, and it can cause really unpleasant symptoms like nausea, abdominal pain, diarrhea. The vast majority of patients with a sleeve gastrectomy never experience dumping syndrome. The vast majority of patients with a gastric bypass do not have serious dumping syndrome long term. Patients with duodenal switch and other operations, it's sort of plus minus. Dumping syndrome is something that is almost always modifiable by what you eat and how you eat it. So many patients with a gastric bypass will tell you that dumping syndrome is a double-edged sword. It is feeling crummy when you eat a bunch of sweets really quickly. So yes, nobody wants to feel crummy when they eat, but it's also a cue that helps people understand that they can't eat that piece of cake and another one real quick because it'll hurt, it won't feel good. There is a very small minority of patients, 1% or less of patients, who have very severe dumping syndrome that is related to the way their gut hormones work, and it's not totally modifiable by diet. For those patients, there are interventions to fix it. Most patients do not struggle long-term with dumping syndrome. Your body adapts to your surgery over time, and dumping syndrome can be managed. And for some people, for some people with a sweet tooth, they actually say it's a helpful thing to know that putting too much carbohydrate into your system too quickly makes you feel ill. So it's not something we hope that anyone will get. It's something that happens most commonly with gastric bypass. It's something that's manageable with the way you eat after surgery for the vast majority of patients.